Welcome, my dear friends. I welcome you all. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all. Welcome, welcome. Myself is Professor Dr. Rajendra Raghuveer Deshpande. Today's topic is Nasya nasal medication, part 2. Of course, this is a part from the Panchakarma. Let us first have the look on this slide. Better way, I will make the screen bigger. Yes, then it's more fantastic to look. So Nasya nasal medication part 2, it's a part from Panchakarma. My dear friends, myself Professor Dr. Rajendra Raghuveer Deshpande. I am MD in Ayurvedic medicine and MD in Ayurvedic physiology, Kaya Chikitsa and Kriya Sharira subjects. This is my personal website ayurvedicfriend.com. Then this is my WhatsApp number 922-6810-630. This is my mail ID, professordeshpande@gmail.com. Yes, people ask why you are showing the mail, because many people are interested to communicate with Professor Deshpande. Because I am very thankful to all my viewers, all my subscribers who are from Ayurvedic fraternity, allopathic, homeopathic, Nisargopachar, naturopathy, and also the pharmacy as well as the physiotherapy. So there are students, there are teachers, there are doctors, and they support my these efforts. I am very thankful for all of them. So many of them are interested for online consultations. Some are interested to understand the palmistry from me. Some are interested to learn from online teaching. So anybody is always welcome, but I request, please write your name, address, college, where from you calling, why you are intending to write me SMS and WhatsApp, because many people just mention, hello, sir, how are you, sir? But I don't know who are you. So I request all of you to write your name, address, college, etc., etc. Your information, I will send you my information. Okay. So let us begin the topic. But before that, make a short review. Now, when you go to the YouTube and there is a search box, please type Rajendra space means you have to make a space bar and then Deshpande. Rajendra Deshpande. This is my YouTube name. Don't type over there Professor, because Rajendra Deshpande, then you will get the my what you can say, the photograph and the menu or the toolbar, and in that toolbar you have to click on the playlist. Remember my word, playlist. And in that playlist there are nearly 15 to 20 groups, and for this topic you have to click on Panchakarma. Nearly, my dear friends, 8 to 10 videos have already been uploaded. Snehana Karma 4 videos, Svedana Karma 5 videos, Vamana 4 videos, Virechana 4 videos, Basti 2 videos. So please, in addition to this video, you please check my Panchakarma playlist and see all the videos. You will be benefited much more. Now, regarding the Panchakarma. Pancha means five and karma means processes. Moreover, Panchakarma means purificatory processes, body cleansing, detoxification of body, Shodhana Chikitsa. Shodhana Chikitsa is similar word for Panchakarma according to Ayurveda. Basically, when we treat the patient, treat in a two fashion. Two ways are there, basic two ways. Shodhana and Shamana. Shodhana, cleansing. Shamana, palliation. What is the main difference? In a Shodhana Chikitsa, when there are vitiated doshas, Vata, Pitta, Kapha, Utklishtavastha. Utklishtavastha. There are so much increase in quality, quantity, and function. They are disturbing our body, and so we kick them out. These bad doshas, pathological doshas, we remove from the body. We take them out. When we take them out, that is a shodhana. Pathological doshas. I am talking about pathology. Bad, bad, bad. Bad boy. So doshas are bad, bad boys. When they become bad, we kick them out. Like the naughty students from our classroom, if they disturb me, sometimes I say, keep quiet. But if I don't agree, get out from my class. So this is something like that. But there the person should be little bit strong and dosha should be too much vitiated. Now, if the patient or the person is weak, low weight person, vata pradhana prakriti, and doshas are not utklishtavastha, moderate or mild type of pathology, then no necessary of shodhana. Then what you can do? Shamana, palliation, palliation, vatagna chikitsa, pittagna chikitsa, kafagna chikitsa, anti-vata treatment, anti-pitta treatment, anti-kapha treatment by ahara, vihara, and aushadhi, diet, lifestyle, and medicines. So, amongst these five processes, Vamana, Virechana, Basti, Rakta Mokshan, and Nasya. Vaman is predominantly for Kapha Pitta, then Virechana is a Chikitsa, therapeutic purgation. Vamana is a therapeutic vomiting. Basti is medicated enema. Best Chikitsa for Vata imbalance, Vata dosha prakupita. Then Rakta Mokshan is for blood, if blood is impure. And Nasya is for Urdhva Jatrugat Vikareshu Visheshat Nasyam Ishyate. Urdhva Jatrugat Vikar. Jatru means clavicle. Whenever the problems for ear, nose, throat, eyes, head, then Nasya is the best. All the problems of brain, Alzheimer, hemiplegia, Parkinsonism, insomnia, epilepsy, hysteria, this and that. Nasya is the best. This is very specialty. Second point. Although we say that Panchakarma is a Shodhana Chikitsa, some of the types, subtypes I can say, they are not always Shodhana. In Nasya, now you will see, there is a Brinhana Nasya, nourishing nose drops, nourishing. So that is not Shodhana. So in the part of Panchakarma, there are also some nourishing treatments. For example, when you say Basti, and if I give Anuvasana Basti, is not Shodhana. This is not Shodhana. Yapana Basti is not Shodhana. Mocha Rasa Pichha Basti for ulcerative colitis, no Shodhana, it is Shamana. So some of the Panchakarma procedures are also used for what? Shamana, palliation of doshas, bioenergies. Next important point. Panchakarma needs experience. Ayurveda says how the student of Ayurveda should be. You remember these three words? In my college, in my lab, what you can say, the lab, Professor Deshpande, when he is HOD since last 30 years, he has mentioned the student should be Shruta Karma, Drishta Karma, and Kruta Karma. Shruta Karma, good, hearing and reading, sensory inputs, attending the lectures. Then Drishta Karma, he should see some procedures done by the seniors, done by the professors, done by the lecturers. And then Kruta Karma, hands-on training. Yes, myself, Dr. Deshpande has a very good team of doctors. Dr. Sachin Sarpotdar, Dr. Ananda Butske, Dr. Shirish Deshpande, Dr. Mahesh Patil. So many doctors are joined with Dr. Deshpande. Because Dr. Deshpande has made this team when he propagated Ayurveda, America, Switzerland, Germany, Italy, Spain, from 1993. I'm sorry, 1993 to 2014, 20 years Professor Deshpande visited many countries. At the moment, we are running in the center, in the Spain, Port Salvi. Just Corona, this time we are not there. But remember my words that Panchakarma, if anybody wants to learn Ayurveda directly, hands-on training, they come to me, they mail me, they WhatsApp me, and I will train them. My team will train them. Okay? So, another important point for Panchakarma. Charak has mentioned the names Vamana, Virechana, Anuvasana Basti, Asthapana Basti or Niruha Basti, and Nasya as the part of Panchakarma. Charak has not mentioned about Rakta Mokshan. But Vagbhat and Sushruta, these Ayurvedic scientists, have mentioned Panchakarma as Vamana, Virechana, Basti, Rakta Mokshan, Nasya. Okay, so you understand this. Another one important misunderstanding about Panchakarma, Keraliya Panchakarma. My dear friends, in South India, Kerala or Tamil Nadu and all these places, Ayurveda is working well. Like Maharashtra, like UP, Kerala is also the best center for Ayurveda because they have the good human resources. People labor is very cheap. They have the ample of seashore and coconut trees. So ample of what you can say the oils are available. And so they use a lot of oils for different traditional therapies. But I personally feel apart from Vamana, Virechana, Basti, Raktamoksha, Nasya, whatever in Kerala they are doing or we are also doing in foreign countries or here in Maharashtra also, Shirodhara, Shirobasti, Kaya Seka. So these type of treatments are not actually Panchakarma and they should not be called as a Keraliya Panchakarma. Personally, Dr. Deshpande don't agree with this. They are good therapies, no doubt about it. I am going to explain you all these things. But they can be called as, because they are started from Kerala, Keralian traditional methods, Ayurvedic treatments. That is okay, 100% correct. But when I say Ayurvedic Panchakarma, it is only and only Vaman, Virechan, Basti, Raktamoksha, Nasya. Another point regarding the Panchakarma needs skillful training because it has a Purva Karma, Pradhana Karma and Paschat Karma. Pre-operative, operative and post-operative. Purva Karma, Snehan and Svedan. Oiling, lubrication and fomentation. To make the organs well, strengthen and also giving what you can say the stimulation to dosha should come to the nearby viscera. For Vaman, they will be brought to the amashe and they are taken from upside. For Virechana, they are taken to amashe, intestine, and they are taken away from the rectal region, anorectal region. Now we are talking about Nasya. I have already uploaded Nasya part 1 in Panchakarma playlist. Please see that video. Let us start part 2 video, Nasya classification according to the action. Action. That is called as a Karmukatva. Can you see the screen? My cursor, Karmukatva. Reference, Ashtanga Hridaya Sutra Sthan 20/2. First is action is Brinhana Nasya. Brinhana is a nourishing to all indriyas, all local organs, face, nose, eyes, ear. Then Jnanendriya and Karmendriya. What are the Jnanendriya? Sensory organs. Shrotra, Tvak, Chakshu, Rasana, Gran. Ears, nose, eyes, tongue and skin, indriyas. And motor organs, Vak, Pani, Pad, Payu and Upasth. Pani means hands. Vak, Pani, Pad means lower extremities. Payu, genital regions. Guda, anorectal regions. So genital, all these organs are called as a Karmendriya. So these are main centers are here in the brain. So when we, because nose is a door door for the brain. And that's why they do the bruhana, nourishing to the cerebrum, nervous tissue. Nervous tissue, nerves are get enriched nourishment through the Tarpana Nasya, Tarpana, to control the Dhatukshayajanya Vata Prakop. Because Vata Prakop is always of two types. Margavarodhajanya, obstruction, because of the Ama toxin. And another is a Dhatukshayajanya Vata Prakop, deficiency, रस असार, रक्त असार, मांस असार, धातु क्षयजन्य वात प्रकोप, cerebral atrophy, dementia, Parkinson's. This is a deficiency. ACH deficiency. What is the disease? Acetylcholine deficiency. Tell. That is called as a myasthenia gravis. Deficiency of dopamine. Tell me the disease. Deficiency of dopamine, Dhatukshayajanya Vata Prakop. What is that? Parkinsonism, right? So in this way, you must integrate the knowledge of modern science and Ayurveda. Degenerative pathology like senile dementia, Parkinsonism, deficiency of dopamine neurotransmitter, it is not given in the Samhita Granthas. Samhita Granthas, Charak Sushruta Vagbat are always telling us, we are showing you the path, we are showing you the direction, and Vaidya should use his own intelligence to add the matter, to add the knowledge. This is that. Dr. Deshpande has added, his team has added this particular information, okay? Because somebody said, sir, it is not given Brinhana Nasya in our Samhita. Forget about it. Charak has given the guidelines. Sushruta has given the guidelines. Myasthenia gravis, deficiency of acetylcholine neurotransmitter, Bell's palsy, facial paralysis, action, dryness in the nose and throat, migraine in the thin female patients. Usually plain or medicated ghee is used for Brinhana Nasya. That is Shamana Nasya. Om Shanti Shanti, pacifying, relax. When dosha prakop is moderate and the patient is weak, when we cannot use the strong shodhana, then we use the Shamana Nasya. Virechan Nasya is very strong. Virechan Nasya, Shodhana Nasya is a purificatory Nasya. It is used when dosha prakop, vata, pitta prakop, very strong. Kapha prakop. Patient also should be kapha dominant prakriti, very strong. Conditions are treated like heaviness in the head, chronic sinusitis, then anosmia or loss of smell sensation, and tumors, thyroid or other tumors. But my dear friends, you can always try for Brinhana Nasya. Young doctors, don't take risk. Virechan Nasya you should have the enough training. Then only you try Virechan Nasya. Otherwise, what you can do? Yes, you can do Brinhana Nasya safe. You can do Shamana Nasya safe, no problem. Dose is small. Virechan dose small, but very strong, irritating, cautious. Nasya types according to the dose. The names are Marsha Nasya and here. Can you see cursor? Prathimarsa Nasya. Marsha dose is more. Quantity of oil will be more. So cautious. Unless and until you are trained, don't do it to begin with, because patient will be upset. Patient will not be happy with you if you are wrong. Take care, okay? Dose is 8 to 30, 2 drops in each nostril. Very difficult. It is used when dosha prakop is moderate and severe. Patient must be strong. Body weight good, muscles good, fat good. Kapha dominant prakriti. Psychologically also patient should be cooperative. Doctor, do it. Don't worry, I am very strong person. Then do it. If patient is afraid, pravara sattva, madhyama sattva, avara sattva. Best mental strength, moderate mental strength, weak mental strength. Don't do this when the patient is not confident with doctor or is not confident with himself. Then don't do it. First do the counseling. Counseling, Ashwasana Chikitsa. Don't worry, I am here. It is nothing, not fatal. Don't worry, but beneficial. Try to convince and then do the Marsha Nasya. Okay? Ghee or oil again. Can you see the cursor? Ghee or oil is used. Next. Prathimarsa, safe. Bindhast. Relax. Don't worry. Always try for Prathimarsa Nasya. Any patient will cooperate you. He will be very, very happy. Very happy. If you do it very good, patient will relax. Doctor, best treatment. I have heard these words from the foreigners, from German patient, France patient, Spanish patient. I have heard this statement after this Prathimarsa Nasya. They are very happy. Doctor, nose is very clear. Huh? I am feeling well. No cough, no secretion. Best treatment. Doctor, I got very good sleep at that night. You are successful. You are successful. You are benefited. Prathimarsa Nasya is best for practice. This is Dr. Deshpande's suggestion. Only 2 drops in each nostril, very soft and gentle, can be used as a preventive. This is most important. Preventive measure, dinacharya, daily routine, Prathimarsa Nasya, not Shodhana. Preventive measure or dosha prakop is mild. This can be used for weak person, delicate people, in children, old people, females, nothing to be worried. Prathimarsa Nasya is a safe Nasya. It is also called as a Ajanma Marana Satmi. Ajanma Marana Satmi. Janma Marana Satmi. From birth to death, it is very safe to give. But don't try in an infant, sir. Unless and until some senior most physician advise you. Don't do it. Because there is not any fear of side effects as the dose is very low, 2 drops in each nostril. It can be performed anytime at any age in any person. Now, again, another Nasya types. First, we see the Karmukatva action, then we see the dose, and now we are seeing the substances used. Substance used for the Nasya. First is Avapidak Nasya, Pradhaman Nasya, and Navan Nasya. Remember these names. Avapidaka is Shodhana. Avapidaka is a Shodhana Nasya. It is Shodhana and Stamban, 2 types. I am sorry, Shodhana and Stamban. But what is the speciality? Here we don't use the oil and ghee. We don't use oil and ghee other than sneha, other than fatty substance, other than oil and ghee, then only Avapidak Nasya. In Pradhaman Nasya, we use the herbal powders, churna, vanaspatinse churna. And in Navan Nasya, we use, this is very common. Navan Nasya is very, very common. Navan Nasya with oil and ghee, very, very common. Very rarely we do Avapidak. Very rarely. Very few Vaidyas are doing, and very few times. Not every day. Pradhaman also very uncommon. It is not common. Only in emergency. Not common. Not common. What is common? Navan, write down. Navan Nasya is common. Next. Avapidak, where the pest of the medicine, kalka, vanaspaticha kalka, chutney, pest of the herb is prepared, and it is the squeezed in the nostril, and the or you can take the juice of the plant, juice of the herb, extract of the plant, and drug is administered to the nasal passages, nostrils. This is Tikshna Nasya as well as soft. When we do the Stambhana, it is soft. So both the types are there. But we don't use directly oil or ghee. Nasya type substance is used other than Sneha Dravya. Chakrapani. Who is Chakrapani? Tikakar. Critics on Charak said Avapidak is of 2 types, Shodhana and Stambhana. Avapidak Shodhana Nasya. Example, Nasya of Palandu, that is onion, swaras, juice, is indicated in Manasa Vyadhi. like Unmad, hysteria. Hysteria is also called as a ACR, acute conversion reaction. Hysteria is old word. I know many people still say only hysteria. Very few people, topmost, very qualified and intelligent doctor, they only use this word new term for hysteria. What is that? ACR, acute conversion reaction. I know hysteria is common, but you also remember this word. It is shining, intelligent doctor, update his knowledge. Then apasma, that is epilepsy, murcha, fainting attacks, krimi, maggots in the ear, in the nose, maggots. Then ardhava bhedak ityadi, adi, shiro roga, migraine like headaches, coma. Very rarely we use, very few Vaidyas, very few exceptional. We don't use commonly for the coma, poisoning cases. But here, what I mean to say, here you can use the Shodhan Nasya if you are well trained and experienced in these conditions. Next, Shamana Nasya. Yes, that I have also used and you can also use very well. What is that? Nasya of Durvaswaras, a typical type of grass in our gardens. Cynodon dactylon, Latin name for the foreigners. Huh? Swarasa is used of this durva, or you can use cow's milk, or you can use the sugar cane juice. Very rarely we don't use. Yes, this we use. Concentrated sugar water. Very easy to prepare. Small little water, 10-20 ml. Put 1 or 2 spoonful of sugar. Dissolve it. Dissolve. And till maximum sugar you have to dissolve in 10 ml or 5 ml. Little, because we need only 2 or 3 drops. So very little. You make a concentrated sugar water. Concentrated sugar water. Total water, no sugar granules. And then with the dropper, you can push 2 drops here, 2 drops here. It can control epistaxis, bleeding. But again, you must have some experience with these patients. Otherwise, you don't try for the first time. Okay. Indicated in Nasagata Rakta Pitta, that is epistaxis. Also, it can be used in weak patients. Pictures are always good. This is Durva grass, Durva grass. Huh? We use for Ganapati, God Ganapati. And this is epistaxis, bleeding from the nose. Can you see? Yes. Pradhaman Nasya. Very careful, huh? Very careful. Caution. Caution. I am warning you, my dear friend, my dear teachers, my dear doctors. This is very strong Nasya. We have to blow the powder in the nose. Huh? This is Mahapana Nasya. Mahapan. Very difficult to pronounce. Dhapan no. Mapan no. Mahapan. The and ma. Mahapan Nasya. Very difficult. Pradhaman means to blow like this. This is a type of only Shodhana type. In this method, dry powders rather than oils are used to blow in the nose with a tube attached to the rubber bulb like that. You have the BP apparatus, broken BP apparatus. Take that broken and take that bulb of BP apparatus, attach in a small catheter, and then when you fill that particular bulb with the powder, clean it very nicely, and then you have to blow that through the tube. It will enter into the, but take a very little, half pinch, not more than that. Otherwise, there will be so much burning in the nose, inside the nose. Mucosa is very delicate. Patient will be get little bit fainting, lot of burning, irritation, and if he is not convinced before giving Pradhaman Nasya, before giving Avapidak Nasya, before giving Shodhan Nasya, the patient should be very faithful on you. You should be his family physician. From generation he is coming to you. He has full faith on you. He himself is a strong person, physically and mentally. then try all these things. To teach in the classroom is very easy. I know. In many colleges, only that, only explanation is given. But when should be done, who has done, practically problematic. This is the thing happened with the Pradhaman Nasya and Shamana Nasya, Avapidak Nasya. Very few places the students get chance to see this thing. But only seeing is not enough. The student should have the hands-on training for this type of Nasya. This is very interesting. Huh? Otherwise, paper roll. I have used this paper roll. Like we make a shengdana. I am forget to bring that paper, but make a roll and then put a very little powder and like this. एक झटका बसतो मराठीमध्ये. A little bit shock is like that. But then otherwise, lot of water will come and sinusitis will go. Congestion of the head will go. He will be also happy. If it is done properly, if the patient is already convinced, this can give miraculous result. Pradhaman Nasya can give miraculous result. I agree that. But proper training, proper precaution should be taken. And after this, Paschatkarma is also important. Apply a little bit ghee. Don't forget to apply a little bit ghee after Pradhaman Nasya. This is my practical experience. Dose 3 pinch is big. I am saying only one pinch to begin with. Half pinch. Enough. Pradhaman Nasya is a type of Virechan Nasya, cleansing Nasya, and it is stimulating to the brain. Traditionally, powders like calamus, vacha, satala, very rarely. Then shikekai, satala means shikekai. These powders can be, but most commonly used is two things. One is a black pepper, mire, maricha, powder, fine powder, remember, fine powder, vacha, or even sometimes dry ginger powder. That is enough. Shikekai is very strong, satala is very strong. Videha, this is the name of a person, scientist. Ayurvedic scientist explained other type of pradhaman. Very interesting, soft. Videhi is very clever. Was clever. Videhi was clever. Take very fine powder of the medicinal herb in very thin cloth and just smell. Strongly smell. Very forceful. That is also, he says, Videhi. One of the author of Ayurvedic text, he says this is alternative, compromise. If you are not confident to, then you can do the smelling, strong smell. That is also enough. Vacha powder or ajwain, ova. Powder can be used in this way in running water from the nose due to the cold or pratishaya. Running from the nose. This is comparatively safe method than blowing powder into the nose. Navan Nasya is our Nasya. Very common. You do it, Navan Nasya, always do it. Very good. This is Sneha Nasya, only Sneha or medicated Sneha. Plain ghee, G-H-E-E, or medicated ghee. Grita, Brahmi Grita, or Anu Taila means oil. Vacha tail will be for Shodhana or Virechan Nasya, drops, but it is safe. Then Pradhaman, then Avapidak. This is safe. Putting the drops is very easy. Anu Taila will be used for Shamana Nasya, Bala Tail, nourishing Nasya for Brinhana, Panchendriya Vardhana Tail. What is the name? Fantastic name. Pancha Indriya Vardhana Tail, nourishing to the Indriyas. Jnanendriya, Karmendriya. Shrotra, Tvak, Chakshu, Rasana, Ghran. Intermittently, purposefully, I am telling you some Sanskrit names because these are the educational videos. I don't want to only propagate myself. Education. So little Sanskrit. Jnanendriya, Karmendriya, and what else? Ubhayendriya. This is my new style, asking you. Tell me. So it's little bit, although it is a Zoom and a webinar, but it's looking like a interactive. Looking like. Your response is question mark. but still I will say, I will try to stimulate you. So Ubhendriya is a man. So all psychological problems also can be treated by nasal drops. Okay? To improve the power of sensory and motor organs, Shadabindu Tail for cleansing the Srotasa, Sroto Shodhana, Shrungataka Marama, cleansing effect. According Pranavaha Srotas, all this part is a Pranavaha Srotas, cleansing of Pranavaha Srotas. According to the quantity of Sneha Dravya, Navan Nasya is of two types, Marsha and Prathimarsa. I have already talked to you about that. Pictures are always good. Now I have tried. Previously in my older videos, there were not too much picture. I was not mature at that time. My some videos are only audio videos. Audios are there. But okay, compromise. That was a compromise. Now I am putting some pictures and explanation, some videos in Hindi, in English. Huh? Shadabindu Tail, Vaidyanath. Excellent remedy for sinusitis. Can you read over here? Yes. Vaidyanath Shadabindu Tail. Same, I think. हाँ? साइनोसाइटिस में परम गुणकारी ऐसे लिखा है वहां पर. Then Vacha Tail. This is my favorite Ayurveda Sisha. Yes, I want to tell you something. If you don't want to do anything like putting the drops, but my interesting finding, please write down. In any allergic rhinitis, any type of allergic rhinitis, some people are allergic to pollen flowers, you know, the flowers, especially European people, German people. And what is that? Spring allergy in Vasanta Rutu. Some flowers are coming and some pollens they give the allergy. In olden days, I remember in my childhood, in some what you can say, the well protected areas in India, I am talking about India, Pune, Maharashtra, Congress Gavat was there. Congress. I don't know why the name. I don't know. Sorry, it is not any other relation. But it was a typical grass which causes many times the allergic type of rhinitis or watering from the nose. But some are having smell allergy, typical smell. Now the Diwali, you know, the chakla, karanji and all the phral, Diwali phral. But some unfortunate people are there who get little bit irritation in the nose when they get a smell of chakli and the chuda and all these things. I am sorry, I am not criticizing, but this happens. Some people have the dust allergy. Now the dust is so common in India, how you can get the protection? This is very surprising. Some have the allergy of hair of the animals, pet animals like the dogs and cat and all these things. Then some have the allergy of fumes. That is air pollution. So the safest way, I will suggest you advise all the patients of allergic rhinitis, simple thing, bring this oil. Can you see cursor? I will make the cursor. I will try to make this. Can you see? Yes, here. Vachate. This is very interesting, like a dropper. Very interesting. So he has to wash the hand, he has to clean the nails, and then little 2 drops here when he go out from the house, this particular allergic rhinitis patient, then apply. Can you see, here is my oil. Apply this oil, Vacha oil. Can you see? Internally. Just application from inside of the nostril. Are you seeing? This is oil I have taken with the little finger. Cut the nails. Cleaning, sterilization, very important. And apply inside. Then that particular layer of lipids will definitely prevent this allergen to attack on the nasal mucosa. Very clear, very strong voice. Each word is like a crystal clear. And people can make the notes of it. So this Pratisarana, Ayurveda has this word, application of oil inside the nostril. Ayurveda has the word Pratisarana, application. So you do it and your patient will be benefited. Indications of Nasya. Brinhana Nasya, where you can give Ashtanga Hridaya Sutra Sthana, chapter number 20 by 4. Vataja or Vata dominant diseases like migraine, Surya Varta, Ayurvedic terminology. Surya Varta, as the sun goes up, coming up, sunrise, headache from morning till afternoon, till evening, migraine attack. Hemicrania, only halfway. It's very similar. Some terms are very common. Huh? This is Ardhava Ardhava constriction of the eyes. Sanskrit words are also there. Interesting slides. So you can improve your Ayurvedic terminology. Also, you can have the better understanding. By the English translation, better understanding. By the bracket words, you are improving your Ayurvedic terminology database. Ayurvedic terminology database. Because even now foreigners are interested to know original word. Okay, so Akshi, Sankoch, then tremors in the eye, like this. Can you see? Can you see? Yes. Tremors of the eyes, Akshi Spandana. Then defects of the vision, Timira. Difficulty in getting up from the sleep, Krichra, difficult. Avabodhaka, to get up from the bed in the morning. He's tired. Oh no, I don't want. I want to sleep more. Although he has slept before night at a proper time, he is very difficult to in getting up. So there we can use, because there is a maybe some tiredness in your nerve tissue. So this is a Brinhana Nasya is helpful. Toothache, Danta Shula, Urdhvajatrugata Vyadhi. It is not only related with nose. This is the difference from modern medicine and Ayurveda. Modern medicine, Nasevion drops, artery vena drops, only to remove the block. And there is maybe also what you can say, the recurrence of that thing. Rebound blocking may occur. But this is very interesting. Earache, Karna Shula, tinnitus, that is Karna Nad or Karna Kshved, in the ears. Dryness of the nose and oral cavity, Nasa and Mukha Shosh. Okay. Difficulty in speech, Vaksanga. We can see this problem indication acting, Vaksanga. So you can use this Nasya to treat this stammering speech or any type of problem. Of course, I'm not saying this is the only treatment. This may be the complementary treatment for all other parts. Okay. Hoarseness of voice, that is Swarupaghat. Swara Upaghat. Swara means voice. Diseases of the neck region, that is Manya Roga, like pain in the neck, cervical spondylosis, the patient cannot move. Oh my God, doctor, pain is here. So this is cervical spondylosis. Then frozen shoulder, patient cannot lift the hand. Frozen shoulder, Avabahuk in Ayurveda. Avabahuk, difficult. Insomnia, Nidra Nasya. Now next, Virechan Nasya indications. Shodhana or purifying Nasya, Ashtangarudaya Sutrasthan, chapter number 20. You can refer that. Heaviness of the head, that is Guruta. Then swelling or tumor in the head, that is Shofa. Feeling as if something sticking on the head, Upalep. Something like a sticking, some has sticked on my head. A uncommon feeling, okay? Itching, Kandu on the head, stiffness, very stiff, eyes, ear, nose, neck, conjunctivitis, that is called as Abhishanda in Ayurveda, here. Excessive secretions, that is Srava, from nose, from eyes, excessive secretions. Tylism, excessive saliva also, okay? This is again continuation. Virechan Nasya, excessive salivation, yes. Can you see? Tylism, P is silent. That is called as a prosek. Anorexia, that is Asya Vairasya, difficult. Asya Vairasya, anorexia, loss of appetite, loss of taste, arochak, hoarseness of voice. Hoarseness of voice, Swarabhed, worm infestation in the head, creamy, maggots, ear, anywhere, nose, coryza, pratishay, epilepsy, apasmar. Now, Sarva Shanti 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 Shamana Nasya. Nasya indications for pacification. Reference Ashtanga Hridaya Sutra Sthan chapter 20. Indicated diseases due to the vitiation of blood and pitta, raktaja and pittaja vyadhi, like premature wrinkles on the face. At the age of 30, at the age of 40, yes, I have the wrinkles, but I'm 60, no problem. Okay, then akal vali, that is called as a akala, premature. Akala vali, vali means wrinkles, premature graying of hair. Palita, khalitya, palitya. Huh? So palitya, hair fall, khalitya. Psoriasis or dandruff of the scalp, darunak. Sanskrit words, darunak. Then redness of the eyes, raktraji, here redness. Then blackish discoloration on the face, here vyang, nilika. This is also a type of the discoloration. Bleeding from the nose, that is epistaxis, that is urdhvagata raktapitta. Bleeding from the nose. Navan Nasya, very common, very common. This is Sneha Nasya. I think this we have already seen. I am sorry. Unfortunately, oh God. Okay, okay. This is repetition. Okay. Only Sneha or medicated Sneha is used. Vacha oil. I think this we have already seen. Anutail, Balatail, Navan Nasya, which does the bruhan or nourishment, is called as a Navan Nasya by Sushrut. Brinhana Nasya, the Sushruta is called Navan Nasya. Sushrut said, Sneha Dravya Nasya is given to strengthen the parts like neck, shoulder, and chest also. This is addition from Sushruta. Remember, addition from Sushruta. Navan Nasya, Brinhana Nasya. So there are different types of Nasya by Charak Siddhisthan, chapter number 9. Now this is the classification of Charak. This is the classification of Charaka Samhita. Navan, we have already seen. Avapidak, Napana, Dhoom, and Prathimarsa. These are the types of Nasya mentioned by Charak Samhita in Charaka Samhita Siddhisthan, chapter 9. Students have to remember for examination, oral and viva. Okay. Dhoom Nasya, explained by Charaka. Can you see here? Dhoom. Type explained by Charaka Samhita. Dhoom Nasya. It is little bit shocking to you, or Dhoom is Nasya. This is not our easy understanding. This is special understanding. Okay. A Dhupana is done. Why it is taken into the Nasya types by Charak? Because the medication is given by nose. That's why he has included also Dhoom Nasya as a part of Nasya. It is not drops. Okay. Dhooma is not explained by Vagbhat. He has not explained. Dhupana will be discussed. Dhupana Chikitsa, separate Chikitsa. I am going to explain separate video on that. Here we have some little information about Dhooma Nasya. Can you see in the picture? You have to do this. Very easy and very nice. Best. If you want that particular material for Dhooma Nasya, yes, I have that Dhooma Kandi. We can buy. You can buy from it. Or of course, there are shops also. You can buy from the medicated shop, but you must try this Dhooma Nasya. It's very interesting. Very interesting. For cleansing, sinusitis, headache, heaviness, medicated fumes are inhaled through the nasal passage and are eliminated through the oral route. Don't eliminate anything from the nose because it is irritating. From the mouth, you can exhale. Type Prayogika Dhooma Nasya can be taken daily as a part of Dinacharya. Then Snehika, this is method we used like the Snigdha Dravyas, and Virechanik Tikshna Dravyas are used for Dhooma. My dear friends, I always try to complete within a period of 60 minutes or 1 hour because this is tolerance limit. I can understand for you and me also. I am very thankful to all of you for hearing this Nasya lecture, Nasya video. It's very interesting. You please see my playlist. You check my Panchakarma, all videos, Snehana, Svedana, Vamana, Virechana, etc. I wish everybody best wishes. But before that, I have my request. you please share my videos through WhatsApp, through your mail, and then ask as a health ambassador to everybody, please subscribe to YouTube channel of Dr. Deshpande. He is fighting his level best to share his knowledge and experience. Help him, help him. I wish you happy, healthy, long life. But in addition to that, Diwali is coming in this week. So I wish you all happy Diwali, prosperous Diwali, enjoyable Diwali with you, with your family, with the society, etc. etc. Take care. Bye bye. Now I am closing my video. Okay. So I am making stop sharing. So bye bye. Bye bye to all of you.